Hello everyone. So I'm Grace and here we have Richa ma'am along with us. So today we will be discussing a role play where you can hear a patient coming with nasal bleeding and headache, and the patient is very much concerned and doubts whether he has a very serious illness.
That's right.
And the patient is too much concerned, so you have to give lots of reassurance, and the role play goes like that. So let us see how it is going.
Yes. So I'll play the part of the nurse and Grace will be handling the part of the patient. So let's get started.
Your time starts now.
Good morning.
Good morning.
Please be seated.
Thanks.
My name is Richa. I'm one of the registered nurses working in this community health center. How can I help you today?
See, I have uneasiness for the past couple of days, and I'm noticing that I have nasal bleeding, which I'm really afraid of. And more than that, I have severe headache.
I'm really sorry to learn that you're unwell and you have certain discomforts as well. But don't worry, you have reached the right place. Let me see what I can do to help you. Okay? So before we get into further discussion, could you please help me with your name and age?
Yes, I'm Sarah, and I'm 35 years old.
All right, Sarah. So you told me that you've been experiencing headache and some other symptoms too. So can I ask you some questions about these in detail?
Oh, if you don't mind, please don't do that. I don't have time for wasting. I would like to meet the doctor immediately, so can you please make the appointment faster?
Oh, I do understand that you're in a rush and you want to see the doctor immediately. You can definitely meet him. But at the moment, the doctor is currently taking care of another patient who requires his assistance. So it will take another 5 to 10 minutes for him to come. So in the meantime, if you can cooperate with me, I can ask some questions and get to know what exactly is troubling you. So shall I ask the questions?
Oh, no, this is not the time for that. Sri, please understand my condition. I'm here with a nasal bleeding and you're asking me to give you some questions and answers. That is not appropriate. I don't have time for that. Please consider my case as an emergency case and please do the necessary treatment as soon as possible.
Sarah, I'm only trying to help you here. I do understand your reluctance, but I have your best interest at heart. So I'm only trying to understand what exactly is wrong with you so that I can provide you with the required treatment. So for the doctor to come, it will take another 5 to 10 minutes, as I told you. So if we wait for so long, then we are actually keeping you waiting there. So right now, I'm only trying to help you by taking the information so I can start with the treatment if required too. So once the doctor is here also, I can provide all the information that is relevant to him so that he will also get a clear understanding about what is wrong with you so that he can also start with his treatment, whatever is required.
Okay.
So if you can cooperate with me by answering the questions that I need to ask about the symptoms, then I can make it really quick for you.
Oh, well, in that case, I think I can help you, but make sure that you do it faster.
Oh, sure. I'll definitely do that. So could you please tell me when did it start?
Started a couple of days ago.
Okay. And how frequently do you experience these symptoms?
It is always there and it is throughout the day and night.
So that might be really difficult for you, I assume.
Yes.
All right. And recently, do you feel feverish or do you had fever?
No, I had no such problems any time recently.
What about a family history? Do you have a family history of the same symptoms?
No, but my grandmother died of blood cancer, so that is what is bothering me too much. I also believe that I have blood cancer or something dangerous like that.
I'm so sorry to know about your grandmother, and I do understand that you're having all these worries, thinking that you might also have a blood cancer like that of your grandmother, right? So Sarah, please be relaxed. I know that you're so worried about it, and I would like to tell you that not all the symptoms can be suggestive of a blood cancer, so please do not jump into any conclusions initially itself, okay? So let's discuss further to get a better understanding of it, all right? So I need to ask you one more question. Have you ever, injured your nose recently or something like that? Nothing like that. All right. So can I have a look at your nose, please?
Oh, please do it faster. As I said to you, I don't have time, and moreover, I'm really upset about my condition. I would like to know what is really happening with me.
Sure. I'm also trying to understand what exactly is wrong with you, and I'm only trying to help you here too. So if I can run a very quick examination on you, I'll get to know whether you have any active bleeding points. So may I?
Okay.
Thank you so much for your cooperation. So based on my examination, I couldn't find any active bleeding points. However, I would like to discuss about the various reasons for a nasal bleeding. So shall I take you through those?
Okay.
All right. So nasal bleeding can be caused if there is a burst or a broken blood vessel, or it can be even a sign of fever or sinusitis, or it can be even caused if you have a low RBC count. I hope that is clear for you.
Yes, but I don't think in my case the problem is something like this. I have some serious illness which is incurable, so I'm really upset and worried. I strongly believe I have cancer or some other dangerous illness.
I do understand that you are having all these queries because you have the preoccupied thought of having blood cancer like that of your grandmother, right? However, I would like to tell you that besides the symptoms, besides the causes that I mentioned to you already, there are other reasons which can also contribute to the same symptoms you're experiencing, like a deviated septum or a shifted wall in your nose. These are all various common reasons. Along with these, if you and other environmental and lifestyle factors can also contribute to the same. And I would also like to bring to your attention that not all symptoms are suggestive of that of blood cancer. It can be that of hay fever, common cold, or even dry mucus. There are various other reasons why you might be experiencing this problem. Okay, so it is not necessarily suggestive of a blood cancer, as I mentioned to you. So please be relaxed.
Maybe there may be several reasons for a nose bleeding, but I strongly believe that my nose bleeding is too severe and my headache is also severe. So I don't believe that it is something minor. It must be something very, really dangerous, and I need an expert opinion.
Sure, definitely I'll do that for you. So in that case, I can arrange a consultation with the ENT specialist who will be providing you with further diagnosis and other explanations too. Okay, so shall I make an appointment with the ENT specialist?
Oh, sure.
Then? All right, so would you have another 10 minutes to spare?
Okay.
All right. Okay, so please wait here for another 10 minutes and the ENT specialist will be here very soon. Okay, so thank you so much for your time. In the meantime, if you require something, please contact us.
Okay.
Thank you so much.
Thanks.
So that's the end of our 𝗥𝗏 discussion, and it was a pretty stubborn case, right?
Yes.
The patient was not at all cooperative and he wanted to see the doctor immediately,
Yes.
right?
But at the same time, we have to give certain information to the stubborn patient.
It is a little bit hard to convince such a patient, and I have seen many students finding it difficult too. But what you have to try to do in such cases is that you shouldn't be trying to force them and tell them that no, it can't be happened. But what we have to do is you have to provide the assurance, yes, she can definitely meet the doctor.
Yes.
However, whatever we are trying to do in the meantime is for that person's good.
Yes.
So we have to gather information in a very polite way. Tactfully, you have to approach the patient so that the patient will feel like, oh, okay, I have to wait some time, but this person is asking me these questions to make sure that I'm fine in the waiting time, also to get all the information to make sure I'm all right.
And they are utilizing the waiting time as well.
Absolutely.
In such cases, what happens is students lose their confidence when the interlocutor is too stubborn to give the answers. So at that time, understand that the card is demanding the interlocutor to be stubborn or to be reluctant. So understand the task and give the answer appropriately. Even if they are not giving you their time, or even if they are reluctant to understand your points, try to explain the point in the way that you give the points as well as you are making them comfortable.
That's right. As Miss said, it is very important that you do not change your tone, because I've seen many students, they start with a very confident voice in the beginning, but the moment the interlocutor changes their tone into a rush tone, the confidence drops and the student will be sounding very feeble and fragile there. You should never do that.
Yes.
You should maintain your tone there, because if there is a fluctuation in your tone from a confident voice tone to a very fragile one, that indicates that you're not very confident about what you're speaking, and so it also shows that you cannot handle such a patient. So never ever do that. So I hope this session was helpful for you guys, and you guys learned how to handle a reluctant patient and convince such a patient. So straight after this 𝗥𝗏, there will be a session where we will show you how to create statements in a very easy way. So Grace and I will be back with another 𝗥𝗏 session. Until then, take care. Bye-bye. Hello everyone, welcome to the feedback session where we are going to learn how easily you can construct statements. So we just watched a video and I hope it is clear for you guys, and you might have noted how the entire conversation was going there, how the nurse was answering all the questions, how she acknowledged and how she emotionally supported the patient and things like that. So in this particular session, as you guys already know, what we're going to do is we're going to pick each task one by one and we are going to see how you can construct a statement for that. So let's get started. Alright, so this is our cue card. Our setting is a community health center, and let's have a look at the background information here. So you're talking to a 35-year-old patient who seems to be very worried regarding the uneasiness he or she has been experiencing lately. The patient is impatient to see the doctor and is not cooperating with you. To try to console the patient and offer an examination. Okay, so from this very small explanation, we can understand that the patient is very stubborn and is reluctant too. Okay, so let's see how we can deal with the entire scenario. Okay, so the format, how the flow of the conversation is done, as I told you earlier, it is explained in the role play, so you can refer to that. In this particular segment, let's see how we can do each task. So let's pick task number 1. So task number 1 says address the concerns of the patient. So let's see how we can start. So we're going to start like this because we do not know this patient before. This is completely an unknown case. So the best way to start will be by greeting the patient good morning and saying your name and who you are. I'm Ms. Caroline, one of the registered nurses on duty, and then we are going to ask, how can I help you today? So there are different ways, as I always tell you. This is just one way of doing it, and there are a lot of other ways. Okay, you can ask what brings you here today, or may I know the reason for your visit, or you can even say, I can see that you look a little upset, may I know the reason behind it. There are a number of ways to do that. The entire idea is to identify what is the purpose of the visit. So that is what we are going to do here too. So the simple way I used here is by asking a small question, how can I help you today? So the patient will tell you the reason for the visit and you know what to do next. Okay, so we are moving to the next task. Consult the patient and ask for the symptoms, onset, frequency, fever, family history. When asked, explain that the doctor will come soon, etc. So here we have 3 segments. The first segment is consult the patient. The second one is ask for the symptoms. The third one is where we are explaining that the doctor will come soon. So let's see how we can consult the patient. You can say something like this. Please be relaxed. I do understand that you're worried about the symptoms you have been experiencing. Don't worry, we will look into it. So that's a very good statement that you can use to provide emotional support. And then I have mentioned here to collect personal details. So this would be the right place where you can ask the patient to give out his information. So you can ask a question like, for my documentation, can you please help me with your name and age? Simple as that. So imagine the patient told you to call him Mr. Samuel. So that's a name that we have taken here. So we're going to do the next portion, that is asking for the symptoms or about the nature and things like that. So we are going to signpost. So Mr. Samuel, I require some information from you regarding the nature of symptoms and its intensity. May I? So in this particular signposting statement, I have elaborated what exactly I am going to ask, and the precision is a little more stronger. Okay, like what exactly am I going to ask? You can even give a general statement like, I would like to ask you some questions, and then directly ask the questions too. The only purpose here is that you have to always signpost to avoid any clarity problems. Do not ask any questions out of the blue moon to the patient. Instead, tell the patient that you are going to ask some questions so the patient will be ready. So that's what we have done here. Now let's see how you can ask the questions one by one. Onset is our first question, so we're going to ask, when did it start? Simple way to ask, onset. There are other ways also. Okay, so I've explained that in our previous videos as well. So this is a simple way to do it. The second one is frequency. So here the patient is going to tell you the patient has headache and nasal bleeding. So we know that there are 2 different symptoms. So I have split it into 2 different ways. I'll show you how to do that. The first one is I'm going to check about the headache. Do you experience headache always or intermittently? Okay, so when I ask this question, I'm focusing only on headache. I'm checking with the patient whether it has, the patient happens to experience it all the time or intermittently. And then the next question is very simple. I'm just asking a very random question. So what about nasal bleeding? So I'm not framing an entire sentence, a very long sentence there. Okay, so it goes hand in hand. The first question will be, do you experience headache always or intermittently? What about nasal bleeding? The second question. Because when you ask the first question, the patient will tell you, I had the headache throughout the day. Oh, I'll make a note about it. What about the nasal bleeding? So that will go like that. So it will be a continuous conversation there. So next one, we have to ask about the fever also. That point is just missed out here. Don't worry, we can add that point here. You can ask a simple question, do you feel feverish? Simple as that. Okay. The next one is about family history. So you all know how to ask that question. Does anyone in your family have a history of the same or something similar? Then the next point, I'm just showing you how to expand the statements. I'm not showing you the flow of conversation here, okay? I'm repeating this again and again because please do not confuse it by mistaking that this is the entire flow of the conversation. This is not the flow of conversation that I'm pointing out. I'm just showing you how you can create statements for the tasks which are given. So our next line is when asked, explain that the doctor will come soon. So you can expand that in this form. The doctor will be here anytime soon. In the meantime, I will take good care of you. Okay, so that's how you can expand it. Moving on. Task number 3, ask the patient whether he or she has experienced any nose injury recently. So we are going to ask one more thing, right? So I'm just indicating to the patient, I need to ask you one more thing. So in the bracket I mentioned, convince the patient if he or she denies. Okay, you can expect that too because in the background information it is mentioned the patient is really impatient. Okay, so you can expect that. The question to ask about nose injury is this way. This is one of the ways, okay? You can ask like this also. By any chance, did you injure your nose recently? Okay, so there's a very simple way to ask it. The next one, task number 4. Offer an examination. When the patient is reluctant, try to explain the importance of it. So we are going to offer the examination, right? Mr. Samuel, I would need to quickly examine you, may I? Simple as that. The next one is when the patient is reluctant. Okay, so this is very significant for you to understand. So we are going to use a good statement to acknowledge the reluctance of the patient. We are going to say, I can understand your reluctance, but I assure you that I have your best interest at heart. I'm only trying to identify the cause of nasal bleeding. If there is any active bleeding point, I can help you with it. So may I? So that is how we are going to do it. So I explained the importance of it as well. So I made it in a way that the patient will understand, yes, the nurse is going to do this for me. It is for me, for my improvement, or she cares for my health. So if you put it in that way, it will be a little more easier for you to tackle a reluctant case. So that is how you can create a statement there. Moving on to task number 5. Explain the causes. Nosebleeds, burst or broken blood vessels, sign of fever, sinusitis, or in some cases, low RBC count. So let's see how we can create a statement for that. There are various reasons for nasal bleeding, such as a broken blood vessel, or it can be a sign of fever, sinusitis. It is noted that people with low RBC count also experience nasal bleeding. Okay, so we have to put an and here, or not an or, okay. It can be sign of fever or sinusitis. It is also noted that will be better. It is also noted that people with low RBC count can also experience nasal bleeding. Okay, this is a very simple way of doing it. So that is task number 5, where we are explaining the different causes. Okay, moving on to task number 6. When the patient expresses the concern, explain environmental and lifestyle factors can contribute to headaches and nosebleeds. Deviated septum, shifted wall in your nose, common cause. Explain it is not necessarily a blood cancer, hay fever, common cold, dry mucus, etc. So it's a pretty lengthy one. Let's see how we can club it to the previous task as well, because in the previous task, you were already explaining about certain causes. Okay. So then in the next one, the task which we are going to do right now also, you are going to explain additional causes. So let's see how we can club it. Both of these tasks are explaining or discussing the causes. So let's see how we can club it. Okay. So I start with an acknowledgement statement. Your concerns are understandable. Mr. Samuel, please understand that the causes of nasal bleeding can vary. Besides the reasons I told you earlier, okay, so that is how you club it to the previous one. Besides that, certain environmental and lifestyle factors can also lead to headaches and nosebleeds. A shifted wall in the nose or deviated septum is also one of the common causes for the same. What I mean to say is that your symptoms are not necessarily suggestive of blood cancer.
It can be that of hay fever, common cold, or dry mucus. Okay, so that is how we can do that. Now here, let's see how we constructed this statement. I'll just take it a little slower here, okay. So, Mr. Samuel, please understand that the causes of nasal bleeding can vary is an extra statement that you have to put from your side, which is not given in the task, because that is a topic statement that we are going to explain, that we are going to make him understand that the causes can vary, okay. This point, besides the reasons I told you earlier, is the statement that is used to connect it with the previous task, as I mentioned earlier, okay. Certain environmental and lifestyle factors, this point, environmental and lifestyle factors. Certain environmental and lifestyle factors can also lead to, okay, so can contribute to, what's changed to, lead to headaches and nosebleeds. That is how that portion was elaborated. A shifted wall in the nose, this point, a shifted wall in the nose, or deviated septum is also one of the common causes for the same common cause, okay. What I mean to say is that your symptoms are not necessarily, this point, your symptoms are not necessarily suggestive of a blood cancer or of blood cancer. It can be even that of hay fever, the point here, common cold or dry mucus. So this is how you elaborate the task which is given there. So it might look little complicated, but then if you have repeated practice of constructing statements on a regular basis, if you take a task and try to expand the keywords which is given there on a repeated basis, then it is going to be easier for you, because the pattern is similar, somewhat similar in all cases. So if you understand, okay, this is how you have to do it, in this particular cases I can use these sort of phrases, or this usage will be a little more better in this case. So if you have a clear idea about that, then it will be a little more easy for you. The more you practice, the more easier it will be. Okay, so that is how we can do that particular task. The last one, advise a patient to consult an ENT specialist for further diagnosis. Simple task, right? This is something that we do all the time. You can say something like this: Mr. Samuel, please consult our ENT specialist who is an expert in handling cases like these. He can help you with further information. It is very simple, okay? So this is how you can develop or construct statements or sentences for each task given here. So I hope you guys are learning something from these feedback sessions, okay, because I'm trying to show you how you can construct statements from the keywords given in the task itself. So if you're struggling with sentence construction, this is an easiest way that you can follow to improvise that point. By that, we have seen a demonstration of the role play. Along with that, a sentence construction session as well. So I really hope these sessions are being helpful for you guys and you're learning how to improvise or improve your sentence construction ability too. So if it is benefiting, please let us know in the comment section. And if you find it helpful, share it with your friends who are also preparing for OET. So I'll see you guys in the next video. Until then, take care. Bye-bye.
IILT, it's my cup of tea.